We are obviously concerned about the growing number of active cases in the province and growth in the number of people hospitalized with COVID-19. And that's why we ask Albertans really to take this seriously, because we have been, I think, very successful as a province in maintaining the least stringent public health restrictions while having some of the best results in the Western world. That is to say, if you compare our per capita levels of infections, of hospitalizations, ICU admissions, and COVID-19 related fatalities, they have been, until the last couple of months, lower than the large Canadian provinces, lower than, I think, all of the 50 United States, and lower than all of the European countries with less stringent public health restrictions. So that has spoken well of the ethic of personal and collective responsibility demonstrated by Albertans just using common sense and care to follow the public health guidelines. I would, if I was giving that speech, I would reiterate that our primary goal here is to prevent the healthcare system from being overwhelmed. You may recall that back in the spring, based on our modeling, we had opened up the 2,300 dedicated acute care beds in our hospitals for COVID patients and about 560 dedicated ICU beds with ventilators. AHS deserves great credit for having turned on a dime to create that set-aside capacity in case we faced a Madrid or Milan-style disaster. Thankfully, we have never come remotely close to that. And at the peak in the spring, we had fewer than 100 COVID patients in acute care beds, and I think never more than 20 in ICU. So we have done very well against international metrics and against our own modeling, and in protecting the capacity of our healthcare system. I think it's also important to acknowledge that the virus is here to stay. And unless or until there is widespread immunity, either through natural infection or through the widespread use of a vaccine, we have to cope with it, and we have to carry on with life. That's why in my very first address to the legislature about the pandemic, I said, I invoked the British slogan that during the Blitz, keep calm and carry on. We cannot shut down our lives, and our twin goal here is protecting both lives and livelihoods. But that is especially important in Alberta with the depth of the energy price collapse and its economic impact. And that's one of the reasons that we've been intentional about taking a less stringent approach to mandatory public health restrictions, including in the last month or so. Now, as I've said before, Rick, we cannot completely exclude the possibility of targeted, limited restrictions in the future if we determine that a case growth could begin to jeopardize the healthcare system. But if we do that, it will be based not on a hunch, not on political pressure, but on data. And I'll give you one specific example. We see other jurisdictions across Canada and around the world once again hammering the hospitality sector. We have, and I would have spoken to this yesterday, we have the third largest employer industry in the province is the restaurant industry. And thousands of our restaurants are, many have already closed, and thousands of others are barely hanging on and could not survive another lockdown. Could not survive shutting down in-restaurant service, for example. So the leader of the opposition the other day suggested we should start imposing restrictions on the hospitality sector, but that wasn't based on data. As far as I can tell, that was based on politics. Fewer than 3% of the traceable COVID cases in Alberta have been because of spread in restaurants and pubs. So what I'm suggesting, Rick, is that when it comes to any potential future restrictions, they will be limited, discrete, targeted, and focused and based on data, not indiscriminate policies that shut down and impair entire segments of our economy.